Hi friends, Dr. Anjali Taneja here again. So we have just finished a series on gestational diabetes. So let's talk about the same topic today. So what is gestational diabetes? Well, you were not diabetic prior to pregnancy, but because of the pregnancy hormones, which are diabetogenic in nature, there is a kind of diabetes that develops during pregnancy. That is what we call as gestational diabetes. So usually you will be tested for it maybe at your initial visit, and then a repeat test can be offered between 24 to 28 weeks. In the test, a fasting blood glucose is done, and then you are given a measured amount of glucose to drink, and after that first hour and second hour values are taken, which have a predefined limit, and depending on whether the limits are crossed, if the limits are crossed, you can be labeled to have a gestational diabetes. What does it mean? What does having gestational diabetes mean? So, it is a medical complication of pregnancy and it can affect you and the baby both. So, how it can affect the baby? Because of your blood sugars which are increased during pregnancy, the same sugars pass on to the baby, causing increase in the birth weight of the baby, increased complications in terms of respiratory illness, jaundice in the baby, which may require special care. Because of the increased birth weight, the chances of cesarean may also get increased. For you, it means having a diet and management of diabetes, and again increased chances of having cesarean and maybe more stringent monitoring of the baby. So what will happen when you are diagnosed with diabetes in pregnancy? By your healthcare provider, you will be advised to follow diabetic diet. The amount of food to be taken will be dependent on your activity levels, your weight, and the food components which are to be taken are typically like as related to a diabetic patient. So, and you will be put on some form of exercise which is typically post-meal walk. That is, after breakfast, lunch and dinner, you are told to walk for 15 to 20 minutes. So, we give diet and exercise, that is the diabetic diet and post-meal walk. We give 2 weeks for these to act. And simultaneously, you are told to chart your sugars at home, which are 7-point charting, fasting, pre-breakfast, 1 or 2 hour post-breakfast, pre-lunch, 1 or 2 hour post-lunch, pre-dinner and post-dinner. So maybe you are told to do any 2 values every day. So by the end of 2 weeks, we get all the values. The targets are predefined. If after the end of 2 weeks, when you have followed diet and exercise, if the targets are met, then we continue following the diet and exercise regime and continue monitoring. However, in few cases, this diabetes may not get controlled by diet and exercise alone. So in such cases, you may be advised to take medicines or insulin also. Now many patients are scared of insulin. They feel they'll get dependent on insulin. So the good news is this diabetes happens because of the pregnancy hormones. So once you have delivered, the likely event is the diabetes will disappear also, and you will not be dependent on insulin. The requirement of insulin comes down and then stops. So insulin is safe in pregnancy. It does not affect your baby. So don't be scared of taking insulin if required. Good news is that this diabetes usually will disappear after pregnancy. So, however, in long term, the patients who have had gestational diabetes do stand at a higher risk of developing diabetes later in life. So, after delivery, you'll be checked for normalization of your blood sugar levels, and then you are suggested to get blood sugar levels once a year. So, hope you found this video useful. Thank you.